Hi, I'm Tim Watkins, and I'm one of the 135,000 Ohio volunteers for the American Heart Association. When I became involved in the association, I learned some startling facts that I think might surprise you too. Statistics show that heart and blood vessel diseases cause almost as many deaths as accidents, cancer, and all other forms of diseases combined. That means that your chances of dying of heart disease are practically 50-50. This is true whether you are male, female, black, white, young, or old. Today we'll be talking to people from our community who found this out firsthand. The difference is that these individuals have a happy story to tell. They have survived and have triumphed over heart disease. In large part, this is due to major advances in technology and in treatment. But in addition, our guests have learned the risk factors of heart disease and have changed their unhealthy behaviors. This is where the American Heart Association comes in. At the American Heart Association, we're committed to supporting hundreds of vital projects and providing the forums in which medical professionals can share in what they've learned. In fact, since 1948, we've put over $900 million into basic biomedical research, and with very rewarding results. But to save people's hearts, we must first reach their minds. And that's where our public and professional programs come in. In 1992, 850,000 Ohioans were reached with interactive programs that encourage healthy lifestyles. Established programs include School Site, which is for preschool through high school aged children. These fun, active programs teach children healthy habits at an early age to prevent heart problems later on. Other educational programs include Heart at Work, a worksite wellness program which helps employees reduce their risk of disease. And almost everyone is familiar with the community CPR classes based on American Heart Association standards. Today, there are millions of success stories that would have been impossible without the types of research and education sponsored by the American Heart Association. The grandmother who lives comfortably with coronary artery disease, the friend who has given up smoking finally, or Bob, Berberline, Nancy, or Starling, our neighbors you are going to meet today. Let's take a look at a typical problem.
You are watching a man have a heart attack.
Bob, your breakfast is ready.
He's hoping it's nothing, but he knows the signs.
Hi, gang.
Here's your
Oh,
salad.
thanks, sweetie. Thank you.
Hey, you feel all right?
And now is the time he should be getting help. Getting to the hospital at the first signs of an attack can save your life.
Paul? Better get me to a hospital.
An estimated 81,000 people in Stark County have some form of heart disease. In other words, 1 out of every 4 of your family and friends may have a heart problem. Through telling individual stories, we at the American Heart Association hope to educate you on the symptoms of heart disease and how you can reduce your risks. First, let me introduce Bob Kraling, a Canton resident and the retired morning man at WHBC. Also joining us today is Dr. Peter Lee, a cardiologist with Cardiology Associates of Canton, and also the current president of the board of the American Heart Association of Stark County. Bob, tell us about the first time you had a heart attack.
Well, it was right after Hall of Fame weekend in 1978. As a matter of fact, it was August 8th of 78. I had gone into work at 5 o'clock, as I normally do, going on the air at 6. And driving in, I had what I thought was acid indigestion, kind of a fullness, and I paid no attention to it. Shortly after I arrived at the station, I started to feel some nausea, and then I broke into a sweat, and all of the things that I had talked about all my life about symptoms for the heart attack seemed to be coming, but of course it wouldn't happen to me. And so I kept going, and ultimately I got to where I couldn't even lift my left arm to reach the cartridges to put them in the machine to play them. But still, it didn't dawn on me that anything was happening. I thought if I could just get rid of that gas buildup that I had in my chest, it felt like an elephant or somebody had stepped on my chest. If I could just get rid of that, I would be fine. And so I kept right on working, went on the air at 6. It got not a whole lot worse, but it continued to bother me all the while. But I kept thinking it'll go away in time. I stayed on the air until 11 o'clock, as a matter of fact, because a fellow was on vacation. And I decided I'd go home right away. I decided to lay down, and my wife got home at about 3:30 in the afternoon and asked me about it, and I gave her kind of a quick answer as to the kind of problems I was having. She called my doctor. He said, "Get him to the emergency room." I was so sure that nothing was wrong that I drove to the emergency room, got there, and very quickly they said, "Uh-oh," and I was admitted immediately.
Well, you really waited a long time before you actually realized something was wrong
Yeah,
with them.
from about 5 in the morning till almost 3:34 in the afternoon, something like that. Yeah.
Dr. Lee, is it unusual for someone to wait that long?
No, it's actually not uncommon at all for a lot of patients to wait like he did. And he described it quite vividly that he had the chest pain, and he really thought that he had indigestion or heartburn. That's frequently what the patient will say that they had. He also had what we call systemic symptoms. That is, he had sweating, and he was just not feeling well. And so it's not uncommon for patients to wait for a long time before they come into the hospital. But the sooner you can get to the hospital, the better off you would be, especially in this day and age. Nowadays, we have medications that we can use to arrest the heart attack, so to speak, to stop the heart attack. If the medication is effective, we can minimize the amount of muscle damage that you have suffered. So it behooves the patient to come to the emergency room as soon as possible.
Bob, I know you were able to control your heart disease with medication after your first heart attack, but you had additional problems after that. Is that true?
In March of 1991, my doctor discovered an abdominal aneurysm, and we had to do something about that, obviously. And so, realizing that I had had a heart attack before, he said, "You really should have a stress test or a heart cath just to make sure that the heart," because I hadn't had it checked for some long while. I thought I had changed my lifestyle sufficiently, but just to be sure. So I thought, well, I want a heart cath. I made the choice to have them go in and look. Dr. Lee did it, as a matter of fact. And the point is, I had gone in not expecting a heart problem, but simply to reinforce the fact that they could do the surgery on the abdominal aneurysm. I got in there and I heard someone murmur in that little half world that you're in, "This guy is a walking time bomb." So I knew something was going to happen.
Dr. Lee,
Yes.
We hear catheterization and bypass. These terms are used quite a bit. Can you explain a little bit about what they are?
Cardiac catheterization is a procedure where you take a rather long plastic tube and you thread it through the artery or the vein into the heart, inside the cardiac chamber, and you measure the pressure in there, you sample the oxygen and all of that. And a second part of the cardiac catheterization is to take a picture of the heart. Take a picture of the heart as it beats so we can see if all of the muscles are moving in a proper fashion. And after that, we would take a picture of the coronary arteries, and coronary arteries are the blood supply to the heart. With that picture, we can know if the blood supply to the heart is adequate. We can find out if there is any blockages of any of the arteries. In his case, of course, he had a lot of blockages and he required bypass surgery. Bypass surgery is commonly referred as open heart surgery. What that simply means is that the pericardium, which is a sac around the heart, has been opened up, so you expose the heart. In bypass surgery, what we frequently do is take a segment of vein from the groin area, and then we stitch that to the aorta on one side, On the other side of the vein, we stitched that onto the artery downstream from the blockage. So therefore, blood actually bypasses the blockage. Instead of going down through the blockage, now blood goes up through this piece of vein, bypassing the blockage, and supply the artery downstream from the blockage. So that, in essence, is a bypass surgery.
Bob, what kind of changes have you made?
Well, I've made some pretty obvious changes. I'm in a rehab program, cardiac rehabilitation, 3 days a week, Monday, Wednesday, and Friday, at which time I exercise and walk, and it's under supervision. The days that I'm not doing that, I try to do additional walking and keep my lifestyle active. I hope I eat better. I think I didn't think it was possible to prepare fish and chicken so many different ways until I got serious about that. We have become great label readers. Read the labels. In the grocery store, it takes a little longer to shop, but I think it's more worthwhile. Of course, I had stopped smoking after the heart attack I'd had in '78. I think a positive mental attitude is very important as well. I try very hard to eliminate stress in my life, if at all possible. But I do think a good, healthy mental attitude makes all the difference in the world for recovery and for your continued life. I think a positive mental attitude becomes very important.
Thank you very much, Bob. Now, let's take an opportunity to look at another problem that's more common than you might think.
I don't take it that serious. Maybe because I feel that I'm young and it's not going to happen to me.
I still basically think of heart disease as a man's problem. When I was young, I never thought about it. It was something that wasn't going to happen to me.
I mean, we worry about the husband and his cholesterol level. All we worry about is about being thin.
Heart disease does not discriminate by sex. Since 1906, heart disease has been the #1 cause of death for women. The risk rises dramatically for older, postmenopausal women, but as our guests prove, younger women are not immune. Each of these ladies had heart attacks while still in their 40s. First, we'll meet Nancy Elliott, a homemaker and mother of 2 who works part-time at Dairy Queen, and she lives in Smithville. Also with us is Dr. Joseph Sermitis, who is a cardiologist with the North Canton Medical Clinic and a member of the board of the American Heart Association of Starr County. Nancy, let's start with you. You had your heart attack about 1.5 years ago when you were 42?
Yeah, I was 42.
What did it feel like?
It just felt at first like my back was hurting because I had trouble with my back. And then later on, it started going to my chest. And it felt, kind of like a tightness, but it felt like it was coming from my back through to my chest. And I had sweating and nausea along with the pains.
Well, what did you do?
I went to the doctor, and the doctor thought that I had just back muscles were hurting, and just tight. And so he gave me some muscle relaxers, and then I went camping. And then I went Saturday night to the emergency room. And they took an EKG, and they said things were okay. So they sent me home, and then Sunday, late in the afternoon, I went back to the emergency room, and they gave me more muscle relaxers. So then early Monday morning, then I finally went to emergency room, and I was in so much pain I couldn't even walk. And they kept me there, and they thought that, I might have had a heart attack then.
So because you complained of the back pain, they treated you with muscle relaxants.
Right.
Dr. Sermitis, does confusion over symptoms happen often?
Quite often, both with patients and sometimes with physicians also. Patients don't always come in with classic symptoms of chest tightness and chest pressure. Sometimes they do come in with back pain, oftentimes between the shoulder blades. Pain can go into the neck and the jaw. I had one patient who complained bitterly about an earache, and that was his presentation, and he just couldn't understand that that earache was actually a heart attack. Occasionally, a heart attack may present as stomach discomfort. In fact, any discomfort that appears above the waist can be of a cardiac source.
Nancy, is there a history of heart disease in your family?
Yes, my mother died at age 49 from a heart attack, and my father was 66. And also on my dad's side, almost everybody died of heart attacks.
Dr. Semitis, is this also a very important factor?
A strong family history of coronary artery disease does present a risk factor for patients, particularly close relatives such as parents, brothers and sisters, male relatives under the age of 50, or female relatives under the age of 60 are strong risk factors.
Nancy, you had a bypass.
Yes.
Now, are people surprised to learn that a woman your age is having had surgery?
Yes, they are. A lot of people don't really believe it, but I've got scars that proves it.
Nancy, thank you very much for sharing with us.
You're welcome.
We'll be right back. Next, I'd like to introduce Berberline Tatum, a retired guidance counselor from Sowers Junior High School and also a Canton resident. Berberline, you've had 2 heart attacks.
Yes, I did.
Could you tell us what the symptoms were of the first?
The first heart attack, I had sweating, nausea. I was nausea. I vomited. I had diarrhea, and I didn't have too much pain in the chest area, but it just, my hands were numb.
Well, that must have been very scary.
It was.
What kind of changes did you make after that first heart attack?
Not too many. Not too many, because after the heart attack, I felt fine, and I went back to work about 6 weeks later, and I kept doing the same thing I was doing.
Unfortunately, it caught up to you. You had another attack, didn't you?
Yes, I did. 5 years later, August 10th, 1985. I had the heart attack at 4:30 in the morning, and I knew what had happened. And I turned over and went back to sleep. I said, well, there it is again. I turned over and went back to sleep. And then when I got up, I cleaned house. I went to the market. I washed clothes. And I delivered a wedding gift to a godchild of mine. And all this time, I had the chest pains and the pain running down my arm. So I said, well, maybe if I keep moving, I'll feel better. You know, it'll go away. But it didn't go away. So I went to the hospital at night, Altman Hospital. A friend of mine took me to the hospital about between 8 and 8:30 that night. And the doctor in the emergency room just told my friend who took me to the hospital, said she won't make it.
Dr. Semitis, Berberline had heart pain all day long. Why do people deny what's happening to them?
I think that's the key, is that people do deny the fact that that they may be having a heart attack. They're afraid to be told that they may be having a heart attack, that their life may be in danger.
Now, Berberline, you ended up having 3 angioplasties and open heart surgery.
Yes.
What kind of recovery did you have? What was it like?
Well, the recovery was fine, but I wasn't, because I went into more denial, and I was afraid to go to sleep at night, and I entered phase 2, the phase 2 program at Altman Hospital, and I would go every Monday, Wednesday, and Friday, but I would run away and go into the bathroom and huddle in the corner and cry. But I would always go. I would go to phase 2. I would do the exercises, and then I would run away.
And
I just couldn't believe that this was happening to me. I just didn't believe.
and you've continued, though, with the rehabilitation?
Yes. I'm in phase 3 now at the Jewish Center, and I attend Monday, Wednesday, and Friday. I also walk almost every day. Well, I walk 3 to 5 miles a day, and I watch what I eat.
2 more happy endings due to people changing their bad habits and getting the proper treatment. Next, we'll be discussing high blood pressure.
My doctor tells me I've got high blood pressure. I sure don't feel sick or anything. They want me to take medicine. Why should I? Hey, I'm tough. What's the worst that can happen?
Although heart disease is of a major concern for all Americans, it is of special concern to African Americans. High blood pressure, or hypertension, is often called the silent killer because it has no reliable symptoms. No one really knows why African Americans have a significantly greater chance of developing high blood pressure than others. You can lead a normal life with hypertension if it is detected early and treated promptly. And Starling Taylor is a good example of this. Starling is a Canton resident and works at the Timken Steel Mill as a bench operator. Starling, welcome. Starling, I know that you're a diabetic, but did you have any other problems?
No, I didn't.
And what did the doctors find when you went in for a stress test?
Well, after I took my stress test, they found a couple blockage. Then they said my cholesterol was high, and then they said I had high blood. And I said, well, how did I make it this far, you know? But after they examined me with the stress test, and I went back to work, and after they gave me medication, everything was going along fine until I started getting that heaviness in the chest again. But when they got through that second time, they had pinpointed everything that was wrong with me, and I had no idea that all this was occurring in my body because I wasn't having no reaction. I knew when I was having a diabetic reaction or something because I had it since '69, but for these other, no, I didn't have no idea about no high cholesterol, no high blood. But I thank God that they found out about it so that I taking medication now.
And how did they treat that?
Well, they told me to walk more, to exercise more. Mainly was change my way of eating. And now I don't eat no fried food at all. Most everything that I know that what I do eat is baked and broiled. And I eat a lot of fish and a lot of chicken and a lot of vegetables now.
Dr. Lee, it seems strange that Starling could have had heart problems and yet no real symptoms. Is this common with high blood pressure?
Well, high blood pressure actually is commonly referred to as the silent killer. What it simply means is that a lot of patients would have high blood pressure and yet do not develop symptoms. And usually the symptom is a consequence of what we call end organ damage. That is, after a long-standing bout of hypertension or high blood pressure, the end organs are damaged. That is, the heart gets into heart disease, kidney gets to kidney failure, gets stroke, and by the time you get the symptoms, it is not because of high blood pressure, but the consequence of high blood pressure and secondary organ damage. And with Starling, he also had the bad luck, if I may say, to have diabetes also. And diabetics tend not to have a lot of chest pain in spite of the fact that the coronary arteries are blocked. And sometimes they even have heart attack without having chest pain. So the combination of high blood pressure and diabetes in Starling is kind of bad for him.
And this is especially important referring to African Americans, is it not?
Absolutely. Yeah.
What other changes have you made, Starling, in your way of life?
Well, like I said earlier, I definitely had a change in my food plan. My wife, she definitely is on me all the time. And I does more exercise than I used to do. I thought I was getting enough exercise on my job and, you know, running here and running there, but it seemed like I need some more. So I've been walking daily, and my wife also bought me an easy glider. So now I'm learning how to ski, in other words, but it's a lot of fun.
Dr. Lee, since Starling has had early intervention and treatment, what are his prospects?
His prospect would depend not so much on the what we did, but what he is going to do with himself. That is, he should stop smoking, he should continue to exercise, he should watch his diet, he should see his physician regularly, he should make sure that his diabetes and high blood pressure is under control. And his prospect should be reasonable.
We'll be right back with Dr. Lee and Dr. Sermitis. We're back with Drs. Lee and Dr. Sermitis. Research is the cornerstone in the American Heart Association's fight to save more lives. I know that the technology that has resulted from this type of research has probably made a major difference in how you treat your patients. What was treatment like for heart patients back when you began your practices?
Well, I began practice, it's almost exactly 10 years ago now. In those days, when a patient comes in with a heart attack, we put him in bed, give him some oxygen, keep him quiet, and wait and see. And after they have the heart attack, we, of course, treat them for heart failure if they have any. We treat them for abnormal rhythm if they have any, and then just wait. And we frequently don't even do a heart catheterization or any kind of intervention until 6 to 8 weeks after the heart attack. And so it's kind of an expectant therapy. You just kind of wait and see what happens. And that was about 10 years ago.
Now I believe we see a more active role for the physician. Instead of taking this passive wait and see attitude, now things are much more aggressive, treating the patient as soon as they hit the emergency room, or in some studies treating them in their home or in the squad with thrombolytic therapy to try to help open up vessels. Heart catheterizations occur much earlier in patients' hospitalization, as does stress testing. And we have many more treatment options for patients than we did just 10 or 15 years ago.
Can you share with our viewers a little of what they can do to help lower their chances of heart disease?
Risk factors in coronary artery disease mostly include smoking, which is probably the most important thing a patient can do. Is never start smoking, but also stop smoking if they do smoke. Following a low cholesterol, low fat diet, exercise, managing their diabetes.
I think he pretty much said it all. And it's, you know, by the time the patient comes to us, the disease is already there. And I think the important thing is to modify the lifestyle and change the lifestyle of everyone, so to speak, so that they don't engage in activities or lifestyle that is damaging to them. And if you have the risk factors of hypertension or diabetes, make sure that those are adequately treated. I think that's our advice.
Dr. Lee, Dr. Sermitis, thank you very much for being with us. And thank you for watching Reflections, brought to you by the Community Television Consortium.